This is Joy from the Red Femme Rebellion. And I'm here to tell my story. I guess for a couple reasons. Not that I really think too many people are going to be interested to listen, maybe. But because so many things over the course of my life have led me to the activism that I do now. And a lot of the activism that I do now means I only meet with women for brief periods of time. So we usually only get a chance to talk about a couple things or a couple experiences that we share or don't share. And I figure this is an easier way for me to set things out chronologically, so that people get to know me better. And also maybe going through everything will help me process a little bit better, because I have a lot of thoughts about my life and where I am now. So, as I said, this is the room where I slept when I grew up in this house. I was born in the 90s, July 27th. I think J.K. Rowling's oldest daughter has the same birthday, if I'm lucky. I was born in Maryland, but grew up in Pennsylvania. And I was born with a condition called ITP. So it's not that serious a condition when it's run its proper course. So I was diagnosed on birth, and basically ITP stands for idiopathic thrombocytopenia purpura. It's just a really long word to say that my spleen, which is a filter system for your blood, would mistake platelets for disease or bad things, and it would eat them. So platelets are what stop your blood, what clots your blood, so it stops you from bleeding. And so having a clotting disorder is a pretty serious condition, but for most kids, including myself, you grow out of it within a couple years. I don't remember a whole lot about my childhood. Trauma can be so unpredictable. So I don't really know whether that memory loss is permanent or temporary. But I don't really remember any birthday parties that I had as a kid, but I do remember my No More Pokes party, because having a bleeding disorder meant that I got my blood drawn a lot, all the time. And I had horrible needle phobia when I was a kid. I think understandably terrified of them. So I had to get my blood drawn all the time, and it was a disaster. It was traumatic to me as a kid, getting held down, strapped down, poked with needles when I'm screaming. It was just torture, is how it felt. And really hard to understand that young, that you just need to do it. You just need to do it. That's very hard for a really young kid to process. So like I said, I don't remember birthday parties, but I do remember my No More Pokes party. I was 2. The cake was pink, and it had purple writing on it, purple icing, saying No More Pokes. I remember that so clearly, because I had grown out of it. And then less than a year later, my pediatrician gave me the MMR vaccine, mumps, measles, and rubella. It's very common. 3-year-olds get it. And even though they knew at the time that there was instances where that vaccine had brought ITP kids out of remission, they gave it to me anyway, and they did not tell my parents. My parents did not know. So with that vaccine, brought me out of remission, and no more pokes, no more. I had to get my blood drawn every week. And it was a nightmare every time my mom took me. I want to say my dad took me too, but I don't really remember any times that he took me. And it was just a nightmare. A whole Saturday morning, I guess, of crying, fighting to get in the car, screaming and crying, going, knowing what I was going to have to do, fighting, well, waiting forever in the waiting room, like pull a number, deli style, wait for hours until they call you, dreading it the whole time. And then the trauma of once again being held down or forced down to get my blood drawn as a very young child. My mom always bribed me with Beanie Babies, and that if I could get through it, I would be able to go and pick out a Beanie Baby. So I had a lot of Beanie Babies. And the reason I feel like I felt the need to start with this part of my story here, where I grew up, is because I'm a victim advocate. That's what I do. That's what my life's work completely focuses on, and the change I want to make in the world is victim advocacy and trauma-informed care and understanding and just empathy all around. And so when I got into radical feminism, especially with the boots on the ground activism that I do, currently a lot of it focused on gender ideology from a victim advocacy standpoint, is that I was medically experimented on as a child. My parents were taken advantage of by Johns Hopkins. That's the hospital that my mom worked for, and they trusted them and believed them when they told them, you have to do this, you have to do this. And besides the weekly blood draws, I got treatments. And I use air quotes because none of them ever really treated anything. They didn't treat me for what was wrong. Nothing ever stuck more than, I think, a couple weeks. A couple months was the longest. I'm not really sure as a kid. But these IV treatments, that were, throwing everything at the wall to see what sticks and what would bring up my counts, because we're monitoring my platelets every week. A normal person has between 150 and 350. That's so weird that that's moving. This house might be haunted. 150,000 to 350,000 platelets in their system at any given time. And there were multiple times during my childhood where they couldn't find any platelets in my system. And so it was absolutely a cause for alarm, absolutely worthy to try to change to a degree, for sure. But I had horrible reactions to these medications, some of these medications. A lot of pain, a lot of nausea, a lot of anxiety and stress, and one medication, my mom always said after we stopped doing the meds, after I had a particularly bad allergic reaction to one of these medications that left me at 12, I think, like writhing in pain, and nothing could make it better. And my mom just said, I'm done. I'm not experimenting on my daughter anymore. I can't see her in pain like this when it never helps. And that's it, we're done. And that was the last treatment I ever got. And here I am. So But one of those treatments that I got for years was one where they would come to my kitchen counter. I don't know if I got that in the shot earlier, this big blue counter in our kitchen. And they would deliver it with an IV. Like a nurse would come to my house, put my arm up on the counter and, do all the disinfecting, and then deliver this IV medication over the course of a couple hours. I just sit there. And that medication is now illegal to administer outside of the hospital because so many patients had heart attacks in their homes. So I was a child being given this medication, and as I was older, my mom especially was very honest about the fact that these were experimental treatments, and nothing ever fixed the problem. Right now I hover at the bottom of normal, so I just live my life, lived that way since I was 12, and who knows if those medications are going to have any affect me, what effects they've had already with my health, what they might affect later on. No one can tell me because they don't know. So from a safeguarding aspect, I deeply oppose medical experimentation on children when it is unnecessary. And it was difficult enough as a child to be told something's wrong with you, something's wrong with you, something's wrong with you, that I never felt any different. I mean, I might have gotten a couple bruises on my shins, more bruises than normal that week, but it didn't feel wrong. Nothing felt wrong. I felt fine. But all these adults telling me, you're broken and we need to put you through this hell because you're broken. And it was hell to experience that and not understand or appreciate that I didn't have a choice or a voice over something I was told was wrong that I didn't feel. I cannot imagine being experimented on as a child like that, much less having unnecessary cosmetic surgery, irreversible cosmetic surgery, and hormone intervention that poisons me forever. As a child, being told there's something wrong with me when there was actually nothing wrong with me. I feel so much rage over what I experienced as a little girl. Even on just the medical level. I was not given any therapy. There was no trauma-informed care for me. I was actually shamed and told, stop crying, stop screaming, you're acting like a baby. Because I was a baby. I was 3, 5, 8. I saw a TED Talk about something called ACEs, ACE, adverse childhood experiences. They can range over a really wide spectrum of things, from abuse to parents divorcing or poverty, things that children have a hard time processing and understanding the way adults can, and that helps adults cope with the situation. Children don't have that context. So with these ACEs, it's not about if you have them or if you don't. It's about how many. And the more ACEs you have, the more individual experiences. It can be every time a situation of abuse erupts in a home, and we know how often that can happen in these homes, or how many times you move. Some children move 10 times in their childhood, more. That all of those experiences, they compound on each other. And the more you have, the more predisposed you are to a bunch of different things, I'm sorry, I don't remember exactly. It's really interesting to look into, though. But I did think it was interesting that it was how many. And when I look back on just the medical trauma, every week for at least 10 years, that's 52 weeks a year, 500 ACEs at least. My will finally broke when I was 11. And I do remember this day. There's so many days. I went 500 some odd times. I probably got my blood drawn a lot more than that overall. I don't really remember many of them, but I remember the day when I was 11 because I just felt numb. I remember walking in and sitting quietly and my mom kind of giving me the side eye. And then we went back to the area where they drew your blood, and all the nurses are kind of looking at each other and looking at me like, who is this child? This isn't the kicking, screaming nightmare we've had to deal with for a decade. And finally, someone asked me, like, are you okay? Or is something going on? What's happening? And I remember putting my arm out and saying, you're gonna make me do it anyway. So just do it. 11 years. Every week. They finally broke me. And that's when I started dissociating to cope. This is a pretty mild situation in terms of all the medical trauma a child could endure, and it changed my life forever. Forever. And it traumatized me and terrorized me as a child. And that was over something that was actually wrong that we just couldn't see, that I couldn't see or feel. It is the epitome of failing safeguards miserably. That we are experimenting on children that have nothing wrong with them. That we do not have safeguards in place to protect children from gender ideology and experimental medical treatment that can leave them with a lifetime of medical complications. And that doesn't even include the trauma. PTSD, CPTSD, ACEs, safeguarding. This is why I protest pediatric gender clinics that experiment on children. This is the start of my story, and I hope we both learned something. Thank you for listening, and I'll see you tomorrow.